This is Nan McKay, and this is the story of Ruth Ann White. Ruth White is one of the nation's leading experts on the nexus between housing policy and child welfare. She is co-founder and executive director of the National Center for Housing and Child Welfare, and she's a former director of Housing and Homelessness for the Child Welfare League of America. Ruth has been focused on helping children and people who are homeless most of her life. So welcome, Ruth White.
Thank you, Nan. It means a great deal that you've included me in this program.
Well, we're glad to have you. So let's start out with how have you been doing on a personal level during the crisis?
Well, thank you for asking. It's quite an adjustment, but I do have to say that having this time with my family, unscheduled time that I hadn't anticipated with my three children and my husband's been quite uplifting, I would have to say, in all of this turmoil. Thank you for asking.
So you haven't been driven crazy by your children being on their screens all the time? That's what I hear from a lot of people.
Well, my kids are a little older. I have 19, 17, and 14, but my heart goes out to the people with the younger children who do need a lot of attention. So that would be very challenging.
They do, and it's so hard when they're working from home.
Mm-hmm.
Well, is the center actually open during the coronavirus?
Well, it's interesting. Our business model lends itself fine to this experience because I work from home. I only go to the Hill when necessary, and then my coworkers are the same. They all work remotely, so our adjustment was not an inconvenience at all.
Well, that's really helpful because all of you then are working remotely, so you're used to it. Plus, you know how to communicate with each other. That's great. Mm-hmm. So how is the center operating during the pandemic? What is happening?
Well, now that is a bigger story. So as families and youth have been displaced or worried about being displaced as they've lost their jobs, we're fielding a lot more, I would say, direct service calls. Over the weekend, it almost felt like I was running a shelter hotline from my personal cell phone. So it's been the kind of crisis where you can't run a 9-to-5 business. I mean, you really do have to be available whenever someone needs you. Mm-hmm.
So you're finding that there are a lot of people who you may not have been in contact with before?
Mm-hmm. Well, folks have a lot of questions for our organization because we do lots of research about whether or not government programs are flexible or can they be operated flexibly. And so we've been able to uncover lots of areas where federal child welfare programs and federal housing programs already had flexibilities built in, but they weren't being tapped. So that's something our organization has done for many years. So you can imagine in the middle of a major crisis where folks have to be able to pivot very quickly and provide services they hadn't before, that information becomes very important. So we've had a sort of the professional class of child welfare workers and housing workers reach out to us, but now the young people and families themselves have also learned about our work, and they're calling with questions so that they can navigate these resources. So we've been able to prevent homelessness. We've been able to secure shelter and hotel placements for people. So again, our business model sort of lent itself very well to the current crisis. We're very proud of that.
Well, that's fantastic because I think this group of people who are either homeless or potentially homeless mm-hmm. has got to grow tremendously if things don't change.
It is, and it's also interesting that one of the things we were able to do right off the bat was to instruct states that, there are young people who are living in foster care who, in the middle of this crisis, would be reaching age of majority and be released from care. And we worked with other advocates to make the argument that under this time of national unrest, young people cannot be sent off into self-sufficiency or independence at this time. So many states have placed a moratorium on that process, that court process, and young people are able to kind of stay in their foster homes or their residential facilities, their apartments, until everything kind of simmers down and we get back to whatever normal would be. So yeah, we were able to allay people's fears and slow down the process. That was an important function.
You know, I didn't even think about that group of people. You know, you're absolutely right. All of the people who are old enough that they would be released from foster care
Mm-hmm.
now would have no place to go, and and they'd be in an upheaval, I'm sure, no matter what.
Mm-hmm. Yeah.
Well,
If you look at the college dorms, you know, we were able to reach out to the colleges, but many of the colleges just allowed young people to stay. So when many people were sent home, many college students were sent home, foster youth and youth that would have otherwise been homeless, and to be honest, some international students were allowed to stay in the dorms. So it's not well known, but schools did make some pretty important accommodations.
so are you working on a national level, or are you working through the pandemic mostly with people in your general area, in the DC area?
Well, because everyone's working remotely now, we're able to work with youth all over the country. We've worked with folks in, I'd say, probably 30 or 35 states. And what we do is just, we either walk professionals through the process of accessing resources or their own flexibility, or we talk directly with the youth. Mm-hmm.
So you feel that you can be effective even though it's long distance?
We do, and people are becoming more and more comfortable with this type of format throughout the country. And again, everyone is comfortable with it. So everyone from public housing authority directors all the way to the young people themselves. Yeah.
What have you found in working with housing authorities in general during the pandemic?
It's very interesting. I'm a fan of public housing authorities. I think they're really our front lines in terms of keeping people from experiencing crushing poverty. They also do the opposite, which is they help people move into home ownership. I just feel like the approach that America's public housing authorities take to helping American citizens become self-sufficient it really can't be beat, I think. And during the pandemic, it's been interesting to watch. It's always been the case that if you're living in public housing you get into a very difficult economic situation, you're never evicted for that. Your rent is recalculated and you're able to stay. So during this pandemic, what public housing authorities already had at their disposal was the ability to recalculate rent. And they're doing that. And they've actually, the US Department of Housing and Urban Development was first out of the gate with these waivers that they've offered to housing authorities. So the idea that not only can they recalculate rent, but they can do it remotely over a phone it's been extraordinary. And so what you're finding is public housing residents are generally doing very well. It's folks that are in private apartments that don't have a subsidy that are struggling. So there are eviction moratoria in place in different parts of the country, but I get worried about that because when we have families in private housing whose income has been affected, the shelter line is encouraging them not to worry about it because there's eviction moratorium. But what happens in July when all of that rent comes due? So I'm a big advocate for the public housing authority model. I don't think it's been easy for them, but I think they've worked it out. And I've also been on the phone with some executive directors who are manning the fort, and they're the only ones in the office. Everyone else is remote. So
that's interesting because I have a friend who is not in assisted housing, but doesn't have much in means. And she said it's just being passed around everywhere that you don't have to pay your rent and you won't be evicted. But I said, but it's got to come due at some point. This is not completely you don't have to pay your rent. It's that you don't have to pay it right now if you can't. Mm-hmm. And I don't think that is being communicated to people.
I don't think so at all. And I think it would be very easy to explain that to people. And it's not. But that's one of the other functions I think that our agency is trying to provide, is to get that information out there. And quite frankly, I've had to explain that to some folks running shelter hotlines in different parts of the country. It's a bit of a contradiction too, because if you want rental assistance from some of these 211 lines or the continuum of care folks, they require an eviction notice, but yet there's an eviction moratorium. So there's these contradictions, and we are able to work at the federal level to expose those contradictions and help work through them. So we're learning a lot through this process.
I think everybody is learning. You know, it's just so new for everyone that it's difficult to know. You know, we work in a world that is very much right and wrong, in a sense that in the regulatory world, this is the way you do it, and you don't deviate from those regulations. And now we're kind of on our left foot trying to comply, but then also thinking, is this the right step or not? Have you experienced some of that? People just not sure which way to go?
Have, and I've made some mistakes myself. So what I am telling folks, whether that be, again, young professionals or the youth themselves that are navigating all this, do what you can to keep a diary or a log, because I think and my students, quite frankly, because I teach at Catholic University, as you're watching folks navigate this, or you're navigating yourselves, keep a log so that we can go back and reconstruct what we did, so that if this ever happens again, we'll have a plan in place.
Very good idea, because who knows how long it's going to be, whether it's going to happen again, etc. One of the things that bothers me a lot is that we're hearing more and more about the increase in child abuse. And I thought you might have had some experience in this area.
There's a lot of concern about the fact that there's been a drop in reports of child abuse and neglect. And the reason for that drop isn't because necessarily those cases haven't gone down, but the mandated reporters that would normally identify these problems and make the call to the hotline aren't in contact with these children. So those calls overwhelmingly come from pediatricians and mostly school staff. So teachers are some of the main, if you look at the data, most of the reports come in from education staff. So I am concerned about that, but it's very interesting as well, the shift that you're seeing now with the kind of the child welfare community. It's also the case that about 70% of the calls that go into those hotlines are for families who are struggling financially. So they're unable to meet the basic needs for their children. So you have social workers at schools calling because the child doesn't seem to be showering regularly. And it's interesting because my own daughter, in hearing one of those stories, said, well, when someone's not showering regularly, you shouldn't call CPS, you should call CVS, right? So in other words, why would you call child welfare for a problem like that? Maybe the person needs training on hygiene, maybe they don't have money to buy personal care items, perhaps they're living out of their car. So meet the economic needs with economic resources, but child welfare doesn't really have those resources. So as state budgets are beginning to contract, and there's some concerns about that, folks are saying we have to stop reporting families for reasons of poverty and meet those needs at a community action agency, a housing authority, or things of that nature. So it's kind of an entire reset about what child welfare was doing. We should really only be reporting those cases of abuse, not so much neglect. That's what community agencies should be doing. Mm-hmm.
And there probably are enough cases of abuse.
That's right.
That will keep everybody busy, unfortunately.
Yeah, unfortunately, that is true.
What do you advise in those situations? Do you get involved in the situation at all yourself?
Well, I don't really do direct service, but I work very closely with the staff, and in a lot of cases, I work closely with the parents. That's a legal matter. That's in many cases a criminal matter. But what we kind of advocate for is a shrinking of the child welfare system to really focus intensely on those cases. And if those cases are, you have the evidence at your disposal, I'm for immediate termination of parental rights. I don't see any reason to delay. But it's interesting, for some of the families that we have worked with where we've helped them get resources, once you get the resources in there, you have a better, it's a cleaner transaction. So we thought your problem was housing and poverty, but we've corrected for housing and poverty, and you're just a terrible parent. So once you, once you correct for those problems, the data is more clear and you can terminate parental rights more quickly. But you should never terminate parental rights for reasons of poverty. And that once we sort that out, we'll have a cleaner system in place.
What's the cutting edge line between poverty, terminating for poverty, and terminating for true abuse? You know, you said if you can move them into a situation where the other factors are taken away, you can clearly see if it's abuse, you can clearly see it's a parental issue. But how do you really know the difference when you can't make that differentiation?
That's a problem you don't. It's very difficult. I mean, you know, I do want to honor the work that the clinical social workers do that go in and do these very difficult investigations. But if you cannot control for the poverty and the chaos, and you'll never know. And I think it's a reason why the average shelf life on a child welfare worker is something like 18 months, because it's just very frustrating profession. So we try to bring the economic resources in so we can get that baseline and then determine if it's parenting or if it's parenting. But that's child welfare is not quite at a position where it operates that cleanly at this time.
Are child protective workers considered essential?
Oh, indeed they are, and they are doing what they can. But it is the case that the Children's Bureau has offered lots of flexibility around caseworker visits, and
I wondered.
yeah, so they're doing a lot of that remotely. There are some there's some litigation around this situation around family visits, however. So parents aren't really as excited about that remote visits would qualify as a visit because they want to see their children. So there are some lawyers, there was a case in Illinois about it. But back to, yes, absolutely, they are considered essential. And when there have been other national crises like Katrina, child welfare workers were dispatched from all different parts of the country to go to Louisiana and help families find their children and reunify because there was so much disruption. So yes, child welfare workforce is considered frontline essential employees.
What are some of your other concerns during this pandemic?
My concerns are the pace at which the U.S. Department of Health and Human Services has issued guidance for child welfare practitioners and for the young people and the families themselves. I find that the departments have all operated at a different pace and responded at a different pace. So HUD was out of the gate on March 31st with some Stafford Act guidance. And so the Stafford Act, of course, is the federal law that allows for you to alleviate regulations and make it so that practitioners can move forward quickly to help folks. And you know, hats off to HUD for doing that quickly. HHS was much slower. The Stafford Act guidance came out on May 12th. That was 40 days into the crisis. That's almost not even a Stafford Act memo at that point. So I do have some frustration around that, and we've communicated it.
Do you have anything else you'd like to share with our viewers?
I think one hopeful thing that has sort of emerged throughout this pandemic is how kind and caring and generous folks are to each other, checking in before calls. And it's just, I think it's brought out really a beautiful part of the human element in all of this. And I think we should honor that and capitalize on it and hopefully keep that going forward in our professional lives.
And focus on it, because there's also some people on the other side who are not doing very well in that area, you know.
That's absolutely. And I think that the more we can kind of drink that in when we get it from others, that it makes us a bigger repository or a well for our folks that need us. So yeah, be kind and generous to each other. It's been good to see that.
Well, thank you so much for your contribution. I really appreciate it, Ruth. It's always good to talk to somebody who's really on the front lines, even though you may not do the person-to-person family contact, you facilitate that, and you facilitate the good work of making things better for people because you know enough about it to know where the problems are, and then you know who to contact to get it changed.
Well, thank you for that. I think through my career, I've learned from folks like you that have put all that information in place. So I want to thank you for that. Thank you for making me a better professional.
Oh, you are welcome.